This is Dr. Chris Raynor. He's an orthopedic surgeon and is a critic of my profession, chiropractic. In this video, I will point out Dr. Raynor's mistakes and show how Dr. Raynor has a pattern of interpreting research data inaccurately to further his confirmation bias against my profession. I want to bring your attention to the colors. Anything in purple is something I have laid over someone else's video to give clarity or context in relation to what the speaker is talking about. I will open by analyzing one of Dr. Raynor's mistakes, also known in this video as Raynor facts.
The fact that reliable estimates of the frequency of vascular accidents are prevented by the fact that underreporting is known to be substantial. In a survey of UK neurologists, for instance, underreporting of serious complications from chiropractors was 100%.
This is the article that Dr. Raynor is referencing. This article tells us that various practitioners use manipulation. The article also states calculations based on insurance claim data suggest that among U.S. chiropractors, there's 1 stroke per 2 million manipulations. Remember that number, 2 million. At the end of this article, the authors state, nor do we know who did the manipulations or why. In many cases, the practitioner carrying out the manipulations and the reason for the treatment is not known. Nowhere in this article does it say that underreporting of serious complications by chiropractors was 100%. I need to go off the rails here for a moment, and we need to discuss why this video was created. In the Raynor verse, Chris is an expert in all things. I don't live in the Raynor verse. What you will notice is there are facts that we would agree upon, then there are Raynor facts. Raynor facts are not 100% created out of thin air. They have some basis in science mixed with bullshit manna from the Raynor verse to create Raynor facts. I did not intend for this video to make this turn. However, after watching Dr. Raynor misinterpret facts repetitively, at first I thought it was an accident. In time, I came to realize it was no accident. I want to finish responding to this video, Chiropractic Almost Killed This Patient.
This 28-year-old woman was paralyzed by a chiropractic adjustment. Meet Caitlin Jensen, a Georgia Southern graduate whose life took an unfortunate turn during a regular visit to a chiropractor. Our guest lecturer today is neurologist Brandon Bieber. His discussion will help me explain vertebral artery dissection and how it relates to chiropractic adjustment. Dr. Bieber, if you'll please introduce our first topic.
Cervical artery dissection and stroke occurring after rapid thrust manipulation of the neck by chiropractic. So I have seen this exact problem. I had a patient who had chiropractic manipulation. He had pain and weakness and neurological symptoms on the table. The chiropractor recognized it immediately, called 911. He went to the emergency room. He had a vertebral artery dissection and a posterior inferior cerebellar artery stroke and had some neurological deficits. I've also had patients who have had similar events occurring from other forms of injury, such as car accidents or even relatively mild forms of injury. I had one young female patient who essentially spontaneously developed multiple cervical artery dissections. She kind of stretched her neck and somehow developed 2 carotid artery dissections and 2 vertebral artery dissections. I was unable to diagnose any specific medical condition that predisposed her to this event. This was incredibly rare, and she had a brainstem stroke, and she had a very soft voice and difficulty swallowing, but she actually made an excellent recovery over time.
Imagine being that patient and being frightened of stretching your neck the rest of your life. What if that patient walked into your practice? A simple range of motion exam of the cervical spine before treatment could have caused this problem. Luckily, Dr. Raynor would use that opportunity to promote his practice. Think I'm being hyperbolic and unfair? There's no way you can screen for this type of underlying pathology. While it is exceptionally rare, we always need to be prepared as chiropractors to deal with emergency medicine.
Adherence to informed consent, which currently seems less than rigorous, should therefore be mandatory to all therapists using this treatment.
Here, Dr. Raynor is 100% correct. Caitlin was injured in the great state of Georgia. Currently, the laws in Georgia do not require an informed consent for chiropractic. However, in my state, our board requires all licensees to inform each patient verbally and in writing of the material risk of proposed care. This is a sample of our consent form in the office. California has the most chiropractors in the United States, with approximately 12,000 chiropractors in the state. all of who are required to give informed consent.
Caitlin's mom has this message for anyone thinking of going to a chiropractor.
People should stop having neck adjustments. It's not worth the risk.
I do not wish to take away from this mother, her daughter, her community, or the seriousness and nature of her injury. However, health care is not without risk. Here's an article showing the rate and risk factors for acute inpatient mortality after orthopedic surgery. Orthopedic surgeons operate on a group of patients, and many of these patients have concomitant medical problems. Death is rare after orthopedic operations. In the United States, the rate of mortality after inpatient orthopedic surgical procedures is approximately 1% for all patients. My mother in the year 2022 had a hip replaced and was in that 1% group. I want to be clear, I'm not discounting anyone's suffering or pain. I have aunts and uncles and cousins and friends that have had their hips replaced. Their quality of life is much greater. While my mother did not benefit from hip surgery, overall society does. Certain people take that risk and it's not beneficial for them. Let's once again use the number 2 million as a basis. For every 2 million orthopedic surgeries at a 1% death rate, 20,000 patients will die.
Let's think about it this way. As a surgeon, I am painfully aware of the risks involved in what I do. And before you lie down on the operating table, we will explore all other treatment options that may be available to you. If we do need to move forward with surgery, you will be made aware of the risks involved. And once you're under the knife, I will treat you with the safest techniques available to me. I will not treat the stiffness in your neck with a technique that could paralyze you and change your life forever.
Great job using someone else's suffering as an opportunity to promote yourself. Let's close out with the tail of the tape. For every 2 million patient visits with orthopedic surgeries, you'll have 20,000 deaths. These are US figures. With chiropractic surgical adjustments, you'll have one adverse effect. Every 3 years, you'll have 60,000 deaths from orthopedic surgeries, and according to Dr. Ezard Ernest, there'll be one death in chiropractic for every 3 years. So we have a clear comparison about the safety between our professions. Once again, thank you, Dr. Raynor, for giving me the opportunity to express the safety of chiropractic in response to your video.